My name is Laura. I am 46 years old. I'm from Thousand Oaks, California, and I'm 3 months out of surgery with Dr. Virella. So my initial accident happened when I was 18 in a horseback riding accident. I went riding and the horses were a little rambunctious, and a friend of mine, she bailed off her horse and mine wouldn't stop, and I tried to turn him really sharp and I fell off the horse and my foot was caught in the stirrups and I was dragged over fresh turned soil and rocks with my head slamming. And then I blacked out. So I'm the general manager here at Mission Oaks Cafe, and my day-to-day life is excruciating. I'm on my feet all day, I'm working in the bar, I'm lifting, I'm doing setup, and what was embarrassing was that clients started to see my pain. I was limping because I had pain going down my hip into my right leg. I'd lost the feeling on the left side of my face, which initially I thought was a stroke. Constant ringing in my ears. The headaches were beyond. It was always a migraine almost on a day-to-day basis. And it became difficult to complete my daily tasks and to run a restaurant because I couldn't lift anything. My arms hurt so bad and my feeling was gone in my fingertips. It was impossible to do my job and to do it right, and plus to concentrating with headaches like that and ringing in the ears and all of that. It's not good for a general manager who has to be in the public and work and be fast-paced and do everything you have to do when you've got this major thing going on and you have no idea why. So it's been a journey. So my symptoms got to the point that I needed to get some serious help because it wasn't improving. So I went to the hospital, got in to see a neurosurgeon, and they said it'd be several months. They wanted to do an MRI, but my symptoms were so bad that I couldn't wait much longer to see what was really going on. So I called Dr. Virella. I explained all the things that were going on with me, and because of the severity of the pain I was having and the symptoms I was having, he got me in immediately, ordered the MRI and nerve testing. Within a week, I had the MRI, my nerve testing done, and he had the pictures in front of him and knew what had to be done.
Laura first called the office with symptoms that were very concerning. She had called several of the local universities in town and was told that she had to wait 3 to 4 months before seeing a neurosurgeon for her condition. I quickly realized that she had a problem and she needed to be seen right away. We were able to move several of our appointments around and get her in an expedited fashion. When she came in, she was in very bad shape. We got an MRI scan which showed that she had compression of her spinal cord. Had Laura waited 3 to 4 months, there's a good possibility that she may have been permanently impaired. Laura came to the office a few days later. We ordered several studies, including an MRI and an EMG conduction test, and it was very apparent that Laura needed surgery. She could not wait 3 to 4 months. Based on the results of the studies, we were able to get her into the operating room within several days and decompress her spinal cord.
When I woke up from surgery, I was shocked. My pain was gone. I had no idea it was going to be so instantaneous. I took a week out to rest at home to recuperate, and then after 1 week I came back to work, started doing 4 or 5 hour days for the second week, and after that I was back up to my 10-12 hour days at the restaurant. The pain in my leg was gone. I had the feeling back in my face. My fingers, you know, he said it would take a while for the nerves to come back. It hasn't taken that long. Like I said, 3 months. I'm not limping, no pain in my legs and my hands. I started working out already. I'm doing, you know, a lot of lower body, no upper body yet. I'm trying to take it easy and make sure that I enjoy this the right way and I heal properly. And it was incredible. I had no idea it was going to be this good.